Houston chiropractor, Dr. Gregory Johnson, and you always see me doing treatments on patients for different conditions, but you've never seen how I actually get there and diagnose the patients and what their problems are. So today I'm going to take you through an intermediate patient examination so that you can see the different type of exams that we do on patients to diagnose them and then formulate a treatment plan to treat the specific diagnosis. So first thing we're going to do, and we have Alfredo here, he's going to help us out today. Thank you for that. And we're going to check his posture, so put your feet shoulder width apart. There you go. Now I'm going to have you bend your head forward all the way, and then backward all the way. Now you always look at the range of motion here. Now back to neutral. And take a deep breath in, keep your eyes closed. Let it all the way out and relax. Now what I'm looking for here is the range of motion. You look and see if it's straight or if it deviates off to one side or the other, and it did in his case, went down to the left and then come down to the right on here. And we're looking at his posture. His head's a little bit forward in his posture. See his ears forward of his shoulder here. So he's got what's called forward head posture. And you see that little bump beginning right here. That's right, T1. That's a result of forward head posture. And you can also see from the rear here, his left shoulder is a little higher than the right one because his head's translated on the x-axis that way. So biomechanically also his pelvis has shifted to the left of center. You can't see it from that angle, but it's closer to the left hand over here. So that means he's got a scoliosis or curvature in his spine. I can tell that by all his posture exam. So the next thing we're going to do is have him lay on his back right here on this table for me, Alfredo, on your back. Other back. There you go. Now, these are called orthopedic neurological tests, and these are standard examination protocols that chiropractors, orthopedic surgeons do to determine whether a patient has herniated disc, bulged disc, or just musculoskeletal mechanical back pain. Now this is called a straight leg raise test, and besides the stretching or pulling in the hamstring, you want to identify if there's any sharp pain in the back or shooting down the leg. Is there anything there on that one, Alfredo? Not really. Okay, so if he doesn't have pain there, that's a good sign. If he had pain right here, for instance, at this, say 30 degrees, and he had shooting pain from his back down his leg, that would be called a positive straight leg raise test. That's an indication of a radicular pinching on the nerves coming out of the low back and pelvis, shooting down into his leg, sciatica. So then we would let it down a little bit because his was negative, and I do this really fast. Is there any sharp pain in your back or your leg? That is a Braggart's test, and that was also negative. Now I'm going to do a muscle test. I'm going to test this psoas muscle here. I'm going to push down. I want you to hold it up against me. Hold it up in the air. Now hold it up as I push down. There you go. Now see, he's got a really good strong psoas muscle right through here. So that's the indication of good, strong pelvic musculature. Now let that drop down. Now this is evaluating the actual hip joint. So I'm going to push down. Is there any pain in your hip joint and or your back or pelvis? This is called a Fabry-Patrick test. If that was positive, he would have had pain right in the hip joint. Now the hip's right here, not back here where a lot of people think it is. So he was negative on that too. So that rules out any kind of osteoarthritis in his hip joint or dysplasia in his hip joint. And then we do exactly the same test on the opposite side. Straight leg raise test. Is there any sharp pain in your back or leg doing this one? No. Okay, and then we bring it down, and that's more relaxed, right? And then we do a fast, hard flexion here. Yeah. And is there any sharp pain anywhere there? So that's the Braggart's test again. Straight leg raise test first was negative. Now the Braggart's test is negative. That's telling me he doesn't have any radicular pain coming out of his lumbosacral plexus and the nerves. Let's cross that over. I'm going to push down. And is there any pain in your hip joint or back? So see, he has a negative Fabry-Patrick there on both sides. One thing I didn't do yet, I'm going to push down, you hold it up in the air. Good. See, he's very strong on those muscle tests. That's good. It tells me his psoas muscles that run from the anterior superior iliac spine down into the quads are very strong, and their pelvis means it's stabilized. So now, I'm going to have him lift his head up here. I'm going to hold down. Is there any pain in your neck or back there? Want to do that? Okay. Just right there? Okay. This is called a Soto Hall test. Now, you're checking for pain in the lower cervical spine or shooting pain out into the shoulders, down in the arms and hands. That indicates a cervical pinched nerve or radiculopathy. That was negative on him as well. But he did have some sternal pain there, and as I'm palpating or feeling his sternum where the ribs attach, I can feel there's some sore spots right there, and there, and there. I bet you feel this popping every once in a while, huh? When you're stretching, yep. Okay, now, we always do muscle tests to evaluate the individual nerves too, so push against my hand. Very good. Now, push against my hand backwards. Good. Now tilt. Good. And now tilt. Very good. Turn. And turn. All those were 5 by 5. Those are all good muscle tests. Now I'm going to have you sit up sideways and let's face that away. Okay, the next thing I'm going to test is the deltoid muscle, which shows me the C5 nerve. I'm going to push down. You hold this up. Look straight ahead, though. Hold this up. Excellent. Very strong there. Deltoid. I'm going to push down. Hold real hard. Excellent. Very strong there. That's the C5 nerve that supplies the deltoid muscle. Now we're going to test the biceps. I'm going to pull out. Resist. Good. That's very strong. So C6 is also in good shape. I'm going to push. No, I'm going to push. There. Now this is C7, that's the triceps muscle. Those are all good. We do them on both sides. Hold. Biceps good, C6 good, triceps. There we go. Now this one, push, hold it. I'm going to push it in, you hold it. This one's a little bit mushy compared to this side. Did you feel the difference? So he's got a little bit of a loss in the left triceps muscle, and we note that. Also, when we're doing the neurological evaluation, we want to always check the patient's reflexes. So, that's his biceps reflex, and you probably saw that. Now watch his fingers and hands here. Excellent reflexes there. And we got a good triceps reflex. So we're seeing on this one that the C6, C7, and C8 nerves are all doing very well. Oh, there's a problem. No reflex there. Alright, see, we like to have fun doing this stuff too. Yeah, he's got good patellar reflexes. That's why I don't stand out in front of the patients when I do this. I did this on an elderly Medicare patient one time, and I was standing in front right after I got out of chiropractic college, and she had a hyperreflexia and kicked me right in the groin, so I haven't done it since then. Okay, now, next thing let's do is have you lay on your tummy on this table. I'm going to do a full spinal evaluation now. This is called a full spine palpatory examination, but I'm also going to be doing a couple of orthopedic tests and chiropractic tests to find out if he has any problems in his low back and pelvis, and he does immediately have a left leg that's a ½ inch shorter than his right leg. Now when I bring these up, you notice that gets more even. That tightens up in your lower back there, doesn't it, Alfredo? Now that's called a positive Knockless test and a positive Deerfield test on the left, because his left leg got even when I brought it up. So that tells me the left leg's not anatomically shorter than the right leg. It's functionally shorter because his sacroiliac joints here in his pelvis are misaligned. And that's tender right there, isn't it? Both sides, actually. The left one's even worse. Now we're going to check the sacrum here. This is called the sacral deviation test. I'm going to have you lock your leg flat here, lock it in one shape, and lift that off the table. The right one only. Okay, we watch, see how high and come up. Good. Okay, good there. Now the left one. Now see, he can't go near as high on that left side, so we know he's got a sacral deviation. That's the middle triangular shaped bone right here. And right here is also where we found the sacroiliac subluxation, which caused his left leg to be short. So now we're starting to identify specifically that he's got a sacroiliac subluxation in his left sacroiliac joint. Now we palpate the spine throughout the entire spine. If you watch my hand there, you can see that curvature, scoliosis, and that's tender right there, isn't it, Alfredo? Yeah. And see, he also has paravertebral muscle hypertonicity approaching muscle spasm. That's where the muscles are tighter than they're supposed to be. This is an indication of vertebral subluxation or misalignment of the vertebra of the spine, causing neurological interference. And that's his major complaint. Now, by this time, I've already done the history, the consultation, and the vitals and all that, so I didn't want to bore you with all that. But that's a little tender right here, too, huh? Yeah. And also right here, big time. Now, this is a transition zone from the mid-back curve into the lower back curve. A lot of stress happens right here in what's called the lower thoracic spine. And he has right paravertebral muscle hypertonicity. In fact, you can probably see that on the camera right here. This right side is elevated over this left side, but it's much tenser on the right side than the left side. And that goes all the way up into here. Those are sore too, aren't they? Yeah. Now see, he's got knots in his trapezius muscles, levator scapula muscles, and rhomboid muscles here too. So he's got a lot of tension in the heaviest stress points, which is the curve change from the neck to the upper mid-back. The mid-back curve is supposed to go backwards like this, and then it changes and goes forward again in the lower back, and he's got a lot of stress at this point. And guess where else? Right here, where the curve changes again. So these three areas where the curves change is where most patients have their highest stress points, and you'll find these tightened up more with people with spinal problems and pain and dysfunction. So, now that we've done this, I have determined that he has a left sacroiliac subluxation, a sacral subluxation, which is the middle triangular shaped bone, L3, 4, and 5, which are the last three vertebrae in his lumbar spine, are misaligned they're rotated like this, so I'm feeling more of it on the right. He's got paravertebral hypertonicity. And he's also got subluxations from his mid-back right here all the way down into his lower thoracics throughout this entire area. The middle thoracic spine, actually the entire thoracic spine, emits what's called the sympathetic nervous system as part of the autonomic nervous system. It's fight or flight. You've probably heard of that. That's what causes a cat's tail to get all poofed out when you scare it. It'll either fight or flee, and we have that same neurological type of reaction in ourselves as humans. There we go. Now, you notice I'm adjusting his left sacroiliac differently than I am his right one, because that's where he had the problem. But he also had that right sacral deviation here because he couldn't lift his left leg up as high as he did his right one. Now, I'm adjusting L5 straight down here, L4 in the Z-axis straight down, L3, you notice the angles on my arm change as I move up the spine. There's L2. Now right here is okay, just breathe normal, there you go. This is that transition zone, and it's tight, so we just wait on him to breathe properly and just catch him when he's relaxed. And I'm doing a generalized manipulation, mobilization of his thoracic spine vertebra, but because he's got paravertebral muscle hypertonicity, I'm actually going to dig down into his lower lumbar musculature, which is the quadratus lumborum, multifidus, and erector spinae musculature. And these areas are going to be sore, but they will also start loosening up so that he will get better range of motion and movement in his spine. Now, we're going to do a couple of tests over here to make sure that we actually corrected that. And now his legs are exactly even. And does that hurt less than the first time?
Yes.
Okay, good. Here, hold that there. Now, I'm going to have you lock this right leg straight, lift that right leg off the table again, as far as you can. No, just keep it straight though. There you go. Okay, good. Now do the left one the same. Now see how much higher he went on the left one there? That's pretty much symmetrical now, so we got good correction of that. He did not have any trauma or accidents, so I did not see any need to irradiate him. So we did not take any x-rays on him to get this job done. because in his history and consultation there was no mention of any trauma or accidents, and doing these tests is not showing any pathological issues. Now right here, he's got vertebrae in his upper thoracic spine that are misaligned. So we found that by palpation. Now there we go, you probably heard that one on camera. Yeah, right there's the last one. Now he's got, like almost every human being that has a forward head posture, which you get from sitting at a computer, working on your handhelds. You get these knots in your shoulders. These are called trigger points. Those are plenty sore, aren't they, Alfredo? Yeah, you notice the patients a lot of times will squirm when I'm doing these because it hurts pretty bad. Yeah. And these are very sore when I'm doing this. I understand that, but this is one of those hurt so good type of situations. Yeah, see, he's laughing. He's not quite so sure about that yet. But now, see, he's also got tightness here in this muscle on the scapula, which is called the teres major muscle. So again, we're pushing right on the trigger point. See how tender that is too? Feels like kind of getting a shot right there, doesn't it? Okay, so let's turn you over on your back. There we go. Now we're going to do just a diversified, what's called rotary break here. Drop it right in my hand and just breathe. There we go. And same here. There it is. Excellent. Now take a deep breath in. Let it all the way out and just breathe. There we go. And I'm putting a little bit of spinal decompression in the y-axis on there. Nothing like on this table, which you've seen me do before, which is a full spinal decompression, but I am going to be adjusting his ankles, knees, and hip joints here because he has that sacroiliac subluxation complex. Good. Did you feel that all the way up into your pelvis on both sides? Good. Now checking his anterior pelvis right here for evenness, and that's better. We're going to adjust the anterior superior iliac spine on the right, the left, right there. Very good. Now, what I'm going to have you do is sit up kind of sideways, and let's face this direction. So, we're going to put his shoulders through a range of motion, which he's got good range of motion. I don't hear any or feel any crepitus or grinding in this. So that's good. Just look straight ahead, though, here for me. There. We got a little movement up in there in the glenohumeral joint, which is really good. Now, let's relax this. Perfect. Now we're going to come around and adjust his elbows. Just relax this. The wrist, fingers. We adjust all of the joints and put them into a normal biomechanical range of motion to the integrity of the joint range of motion. It's okay to pop your fingers as long as you pull them straight out like that. You don't want to crack them like that or like that or like that, because that traumatizes them and gives you arthritis in the future. So the next thing we're going to do is come over here, and I'm going to be using a cervical specific, right in front of the mirror again, adjusting instrument that you've seen me use on previous patients, high velocity, low amplitude instrument. And I'm going to have you put your feet shoulder width apart again. There you go. Now let's close your eyes and bend forward all the way. So he's already got better range of motion. Now backwards all the way. Much straighter on that one too. But he's still got a little translation there. So here's a mirror image adjustment. We're going to lift up and hold back and then flare these way back. Now I'm going to be bringing his head straight back in the z-axis, and we're going to translate him a little bit to the right in the x-axis. We're going to adjust the atlas on the right. You got to keep the patient in an exact mirror image of his posture. Okay, you can relax now. Now let's have you close your eyes and flex forward and backwards again. Neutral. Take a deep breath in. And voila. His head's starting to come up and back. How'd that feel that time compared to the first time?
A little better.
Better. Very good. All right. So, What you've seen now is a chiropractic intermediate examination that includes orthopedic neurological tests. This is how we come to our conclusions on how we're going to treat the patient. Some patients I will order full spine x-rays on to find out the biomechanics of their spine and any degenerative changes and or pathology. Or if I suspect that they have a herniated disc with radicular pain in his arms or legs, I would order an MRI. He didn't have either one of those on his orthopedic neurological, so we didn't do that. But I wanted you to see what we do prior to just doing the adjustment, because we don't just come in here and start snap, crackle, popping everybody. We find out what's wrong with him first and then make a clinical decision about the treatment plan. This is your Houston chiropractor. We'll see you next time.